Hi, welcome to the special edition of Education Matters, where we're looking at the reopening of our schools, searching for the new normal in public education. Normally, we always have education officials with us on these programs, but these are unusual times, and I have with me from the New Jersey Association of County and City Health Officials, the president, Megan Avallone. Welcome, Megan.
Thank you.
And I also have from their executive committee, Peter Summers. Welcome, Peter.
Thanks for having me.
And I should mention that Peter's the county health official in Warren County, and Megan is in Union County, but she's the Westfield regional director. As we go into this, first of all, Megan, I'll start with you. Are the health officials working together, I guess through your association, kind of all on the same page?
Yeah, I think it's local health departments and schools, we have a long-standing relationship. We work with schools in ways that the public might not even realize, right? Whether that's flu outbreaks, whether that's measles cases in schools, and even lice, right? So we have good relationships with school nurses and school administrators, and this is no different, although the situation is different. I think statewide, what we've been doing is really trying to communicate openly and frequently with school administrators and school nurses to really figure out what questions need to be answered and what guidance we can provide, and to really develop templates that work for everybody.
Yeah, and Peter, I guess you're a collaborative group. Your health officials, are you guys communicating with each other about what's going on in your regions?
Absolutely. I think if you talk to your health officer, you'll find that every one of us has been has some regional group they're working with. In some counties, you have a lot of local health departments, and they've been meeting regularly to talk about COVID-19. And most of those groups meet regularly as a matter of course. Up here where it's just county health departments in the Northwest, Warren, Sussex, and Hunterdon have gotten together to agree that we're going to provide common guidance to all the schools in our counties, and I think you see that going on throughout the state.
There's a lot of terms that are thrown around in health terms that are thrown around, and I think a lot of our membership and the members of the community need a little clarification on it. Like, what's close contact? Is there an official definition of what close contact is, Megan?
Yeah, so close contact is defined in New Jersey as being within 6 feet of an individual for 10 or more minutes. So for example, if you are at the grocery store and somebody walks by you, that's not a close contact. But if you are talking within 3 feet from your neighbor for 15 minutes, that would be a close contact.
Does that change if someone's wearing a mask?
It doesn't. Close contact definition, masked or unmasked, are still considered a close contact.
Okay. Peter, the other thing, and I know a lot of school districts have this, who gets quarantined? If a teacher, a student tests positive, do you go around that close contact theme?
That's the basis of our decision making. Although it's a fair question in a classroom, who actually was within 6 feet for 10 minutes? I can tell you up in the Northwest, what we kind of started with was we're going to consider a whole classroom to be a close contact unless we know different or the school knows different. But that might vary from region to region. When I spoke to my superintendents, they were kind of comfortable with that. In another jurisdiction, they might want to go student to student to see who actually was 6 feet apart. And that might vary also from grade to grade. You could probably, your AP history class probably can reasonably stay 6 feet apart, and you could expect the students to do that. That's a little tougher for the kindergarten class.
And what about the the testing if someone's on the bus, the student's on the bus? Do you have to do that? Is that through contact tracing, figure out who was on the bus with the student if they were on the bus?
Yeah, I mean, if you, as I recall, the CDC guidance suggested that you could put 11 students on a regular sized school bus. And I know, talking to my superintendents, that's not enough that's not enough kids on the bus to make the bus efficient. again, we're up in my region, we kind of decided that unless we knew different, the whole school bus was going to be considered a close contact. That seems fair to do. It's a really tight space, even tighter than a classroom. But again, if you have that school bus where there's really only 8 kids on it, they might be able to spread out and not be close contacts.
Okay. I've also heard the term, Megan, the term isolation. When someone gets put in, what's the difference between quarantine and isolation?
Yeah, so that's a great question because people, even medical professionals, get this confused all the time. Isolation is the separation of individuals who are sick. So it's if you're symptomatic, you have COVID symptoms, and we're asking you to separate yourself from the general population so that you don't spread the illness. Quarantine is if you've been exposed to the illness, but you're not sick yet. We're still asking you to separate yourself, but you're not sick. We're asking you to quarantine in case you become symptomatic, but both isolation and quarantine serve the same purpose, which is to stop the spread of disease by removing individuals from general public interactions.
And would you recommend if someone, I'm a teacher, but my husband or wife or spouse, whoever, tests positive for, or is not even tested positive, is getting a test for COVID, should that person then quarantine themselves until they find out what's going on with their spouse?
Yes, right. That is one of the messages that we're really, really trying to drive home. Every individual in New Jersey and nationwide should really separate themselves, stay home while awaiting COVID tests. COVID test results. Even if you feel completely fine, if you did get a COVID test, we recommend, strongly urge you to stay home until you get those results.
And how, the test results don't come like in 24 hours. So you could be quarantining yourself for a week or so. Is that correct?
That is true. There is a delay in testing, and we hope with the increased availability of rapid testing that will help us solve some of these testing delay problems. But what we're up against in public health, if you don't stay home and then you find out that you're positive, because remember, we are seeing some percentage of the population be asymptomatically positive, then what we have to do in public health is go back and find out who you were in contact with and notify all those individuals. And really, that's how disease spreads. So we're asking all individuals, and I know it's hard, and I know that residents and parents have sacrificed so much, but if we all do our part, and part of that part is staying home until you get your results, that's truly how we get ahead of this outbreak.
That kind of leads me, Peter, to the next question about contact tracing. I know in the guidelines, it seemed that the DOE was letting the district do some of the contact tracing, but is that the purview more of the health officials?
Yeah, so it is a legal responsibility of the health department, but we do ask frequently for any type of infectious disease. We ask the school nurses to really assist us with that. For example, if Johnny tests positive and he's in a classroom, we don't know who's necessarily a close contact of Johnny or what his day looks like, where he's been in the school, who he's been around, and certainly the school staff can help us decipher that.
So the seating charts and all those other things are a little bit more important than they have been in the past.
For sure.
So, and I would add that, while this health department is going to be taking the lead in contact tracing, we're going to need a close relationship with the school. We're going to be relying on the school to tell us who the close contacts were in that school. And we're almost certainly going to be relying on the school to put out public health information to all the parents. This is probably this is going to be a team effort.
That goes without saying. Now, some of the other questions I know our members have is simple little things, but is there a special, Peter, is there a special face mask they should use, a face covering, or different ones for different types of instruction?
Pretty much for most of your teachers and your students, those cloth face masks are going to be fine. And I'd recommend, you find one that's comfortable and that'll fit around both your mouth and your nose.
Okay. Megan, what about, temperature checks? I mean, do they have to do that? Is there a way to do that? temperature checks at a building?
Do you mean when they, the parents or staff members at the school?
Staff and or students. Some are debating that. Should they take temperature checks of everyone who enters the building?
Yeah, so the current Department of Education guidance in New Jersey says that students should be screened. We are at this point still awaiting Department of Health clarification as to exactly how that should be done, but I think the expectation is that parents closely monitor their children's health, right? That can include a daily temperature check, but certainly parents should be looking for things that that are different than a child's baseline. So, you know, if a child's complaining of a sore throat, if a child has diarrhea, these are all things that parents should be looking out for and keeping their children home for once school starts.
So they should err on the side of caution.
Definitely. The guidance that we have now really includes the full list of COVID symptoms as, you know, reasons to be excluded from school. And those things do currently include, you know, diarrhea, slight fever, sore throat. So absolutely.
And I would just add that I think screening is probably going to be one of the things you're going to see differences from districts to districts, and maybe even grade school versus high school. There are some real practical limitations to in-school screening for large school districts. I know some of my larger school districts are hoping to rely on parents a little more, but others are going to screen every student when they come in. I agree with Megan, though, that the purpose of screening really is to be done before you get to school. So the burden really has to be on parents. If there's one thing that we can ask our parents to do, and we need our parents to do, it's to keep their kids home when they're sick.
And you just follow up on that, Peter. Say a student develops, we all know what fever-like or COVID symptoms during school. What should be the procedure be? Is there not a room to isolate them?
The school districts, at least up by me, are all setting up an isolation room for those students. They're going to need to do that, particularly if they're going to be doing their own screening, because if you have someone with symptoms, they're going to have to separate them out from the rest of the student population. And they also need to do this in as discreet and a comfortable way for the student as they can.
Megan, we talked a little bit before. I just want to re-look at transportation issues. I think that's one of the biggest concerns I see is that the school buses. Some parents are willing to send their kids to school, but not on the school bus. Is there anything special they should do on the school bus besides the guidelines? Because it's, you know, Peter mentioned it before. It's kind of hard to do social distancing now on a bus.
Yeah, I think the things that we're expecting parents to do that they can do is, like Peter just said, you know, we're really expecting parents to screen the children themselves before they even get on the bus, right? So in the morning, you want to go over how does your child feel, take a temperature if that's appropriate. Then you want to get your child a mask that you know that they feel comfortable in. So a lot of school districts have been asking parents to start with the masks over the summer, right? A mask is only effective if you wear it. So, you know, we're recommending to parents, buy different varieties. Buy you know, the most effective mask is the one that your child will wear. Right? And certainly everybody being masked on the bus will definitely decrease transmission risk. And then of course there's some guidance in there that if possible school buses, the windows can be cracked, ventilation can be increased, and of course social distancing when possible. And then reminding children to wash hands frequently, sending your child with some hand sanitizer, having them sanitize if age appropriate when they get off the school bus. I think all of these things are actions that parents can take to keep their children safe.
And Megan, I want to follow. We had a previous conversation and you mentioned this to me. If something happens in the school district, someone tests positive, whether it's a staff or student or should a district communicate with the health officials about how to communicate that to the community?
Always. You know, communications that go out should always be released in conjunction with the health department. And historically, even before COVID, I think that by far and wide, that is happening, right? So the local health department, we're here as a resource to schools, as a resource to parents. And the most important thing for us is that accurate information goes out. So I know that across the state, my colleagues have really stressed to schools that anything that they send out to parents, we're more than happy to review, and we're more than happy to act as a resource for them.
Peter, and we'll be ending with both of you on this one. This is a very fluid situation. It seems like our rules of engagement seem to change all the time. We have to be flexible. What are some advice you would give to a school district, the administration, the school board, as they go through this?
Well, I would start by telling school board members, be patient. That's probably a message for parents too. I guarantee you, your superintendent has been spending a lot of time on this. Mine they all have my cell phone number, and I've gotten messages on weekends, so they're all working. It's a fluid situation though. So the guidance we have today may change, and it may change because the situation changes. So I think everyone needs to be patient. Everyone needs to, pay attention when the school is sending out information on their guidance. I know school board, my wife's the president of a school board, so I know how active school board members can be and how involved they are and how many calls they get from parents. So I would counsel patience and kindness. We could all use more of that.
We definitely can use that. I think it's one thing to say that. I think the community and the parents might be a little hard for them to just immediately be patient. Do you agree, Megan? And how would you communicate in your districts?
Yeah, this is a completely new situation for everybody. We are all working as hard as we can around the clock, 7 days a week, as Peter said. I think school administrators and local health departments, we joke we don't know if it's Saturday or Tuesday because every day looks the same to us. But what I would say to parents is use your Board of Ed and your health department as a resource, right? Don't be afraid to reach out with questions. Don't be afraid to reach out with concerns. That's what we're here for. But also, to follow up on what Peter said, we are all trying to navigate this new situation the best we can. And things may change, right? And they may change depending on the situation. So again, I think it is important that parents and school staff just, keep that in the back of their minds. And a little extra patience is always appreciated from your local health departments.
Well, I really enjoyed this conversation with Peter and Megan about from the health officials' point of view. I think from my perspective, it's nice to see, and I am not sure a lot of members of the public or even some of the school officials know how closely the health officials are working with school administrators. So that brings us to the end of this special edition Education Matters. I hope you found it very informative.